those of us that haven't got the day off, it's really great that you're here. And for those that aren't able to come along today, we do record all our sessions and we do put them in the self-directed support library. So if you need to share with colleagues or you want to look over it again, it's always there for you in the SDS library. That's fantastic. Well, I'm Donna Murray. I'm one of the self-directed support project officers in the team, and I'm joined today by my colleagues Laura and Callum. So we're very pleased that you're here today, and thank you very much for giving us up your time. As you know, our COP seminars are open to everyone, and they're based on, they're usually an hour, and they're usually based on a hot topic or an evidence-based piece of research or some reflections on practice. And usually just about great collaboration with other stakeholders and people involved in supporting the implementation of self-directed support. So as I said, all the recordings are, all our seminars, our COP seminars are recorded and they'll be in the library for future use. And if there's something that you think that we should cover as a COP seminar because it's important to you or it's a piece of practice or something you'd like to know more of, please always approach the team where our programme is flexible. And we really want to be responsive and put on things that are useful to you as very, very busy practitioners. So please don't hesitate to get in touch with us. So today is all about digital responses and digital development. And we are fortunate enough to have Marlene Hartwith from the Digital Health and Care Innovation Centre. And Marlene and our team have been working with our colleagues in Moray to help support older people and unpaid carers to access local services at the right time and to share information just once across the services. And I know that Marlene will be able to tell us more about that. I just want to do a little plug for our Moray colleagues. Moray was our very first implementation partner back in the day when the team started about 5 to 6 years ago. And we know that Moray will be holding a self-directed support community of practice roadshow in November, so look out for that. So we're very, very pleased and feel quite privileged to have a Moray perspective with the digital health angle. So Marlene, I'll hand over to you to do your presentation and then we'll open up for questions. Fantastic, thank you.
Okay, thanks very much, Donna, for that introduction. So I'll go straight into the presentation. There are quite a lot of slides, but just interrupt me in the chat if you feel that you want to ask a question. Okay, so as Donna said, I'm Marlene Hartwith. My background is a senior manager in health and social care. I recognise some of the faces in the call. Say hi to Kim in North Ayrshire. Part of the reason that I'm now working with the Digital Health and Care Innovation Centre is that I've always had a particular interest in digital and really how it can make a difference to choice and control for the person. So I'm working with them on a consultancy basis and particularly around this piece of work, which we're calling Care in Place. Obviously, you'll get a copy of the slide deck, something that you can go back over or use with your own team. It'll give you more information, which I won't go into in detail. But the Digital Health and Care Innovation Centre, it is funded by Scottish Government and the Scottish Funding Council. So we're government funded. We're not selling anything to any health and social care partnership or health board. We're very much working to Scottish Government agenda and also what citizens are telling us that they need at this point in time. I've added a wee map of Moray just in case anybody doesn't know where Moray is. Many of us are geographically challenged in our own country, but if you haven't been there, they sell very good whisky. Not that I don't even drink whiskey, so I would have been happier if it had been Vineyards or something that they were selling, but that's not the case. So the background to this is Moray, it's as far back as 2018, discussions started around the Moray Growth Deal. And my director kind of recognised that this work was going on and made a bid for some this substantial amount of money that was coming from UK government. You can see here it's 100 million. And we were given 5 million of that to look at innovation across health and social care. The other aspects of the Moray Growth Deal include areas such as education, transport, support for universities, so a very holistic approach to try and bring jobs to the Moray area, to retain the population there, and really help the area thrive and grow. So we've now been in Moray for approximately 3 years. We're actually coming to the end of this funding period. I'm going to talk to you today about one area of work. We refer to it as a living lab, but really it's just, you know, you're working in a project in a real life environment where you're co-designing with citizens, you're testing with citizens, building prototypes and then moving to a live system. So a very iterative approach. The first 2 items on this slide are around, these are the 2 pieces that I specifically worked on. And what people were telling us was that they found it quite difficult to understand what was in their local community, particularly unpaid carers, as you know, it was something that could happen in an overnight basis, and social work and health service land just wasn't something that they'd had their head around, and they were trying to identify what could help the person that they were looking after. And the other key thing that we focused on was around repetition. So it won't be new to you, but many of the Scottish Government consultations have raised the issue around people repeating their story and the level of frustration that brings, and also undermining confidence, because it's very clear that services are not talking to one another and they're not sharing information, despite the fact that we have been integrated now for over 10 years. The other areas, very briefly, there is also work going on around healthy living, and that's really around weight management. There's work going on around staying independent, and a lot of that focuses on the occupational therapy service, the introduction of Sarah, and also the telecare service, but bringing new state-of-the-art technology into that lifestyle monitoring, and trying to prevent falls or any type of safety issue within the home. We have also developed in a different living lab what we're calling as a housing blueprint. So along with architects, Moray has developed a blueprint that could be used certainly in new build housing schemes, but it also has some really good ideas in it for existing housing and how that can help meet people's needs. And last but not least, there is also a piece of work going on around the workforce. And they've introduced eMoody, which some of you may be familiar with, but that's around trying to support people's mental health within the workplace, and particularly, you know, focusing on it's has been over the past couple of years quite a pressurised area to work in, health and social care. So eMoody is a way of looking at and testing how we can help the workforce. So that's a quick overview. I would emphasise that that Care in Place could have ended up being anything in Moray, anything in terms of what can keep people in their own home. So we could have been focusing on the home care service and how people communicate better. We could have been looking at care homes and how they can be more integrated in the community. It was really what citizens in the area felt, the areas that they identified for us, that they were most under pressure. So what we have focused on was identified by frontline staff and also groups of older people and unpaid carers in Moray. And I've said before, the two particular things that they wanted to focus on was how they could find services more easily and at an earlier stage, and also how they could tell their story once, how they could communicate more effectively with services in the area, and particularly once they had access services, how they could manage that communication more effectively than constant individual phone calls to different professionals. So we developed Community Connections. So Community Connections, it is a website. It's the one place to go and find support and find services. It might be a bit different from I know that other areas are using sites like Bridget or Mobilise for the very same thing. Some of the things that are different around Community Connections are, one is that we're bringing together all of the local resources in Moray. So we've used the existing infrastructure of Alice, which you might be familiar with. So again, we always try and reuse technical infrastructures that are always there and already there and existing in Scotland. So the process is that we encourage third sector organisations or any service in the Moray area to put the information onto Alice, and then we pull it through into Community Connections, which has a local front on it and is clearly identified as a Moray service. When we started this process, there was approximately, I've had different, I think it was 30 services that were on Alice. And now the services that we've collected and put onto Alice and pulled through into Community Connections is over 700. The link is there to the site. It is still a research site. I'm not going to go onto the live site today, but I would invite you to go in and have a look at it at your leisure. The bit that's a bit different about Community Connections is you can connect to the service from the site. So we've tested that with Alzheimer's, Quarriers, the Community Nursing Service. So what it means is that you can send a self-referral to those agencies, and we could repeat that across all of the 700 contacts on the site. The service itself develops a small questionnaire, and what that means is we describe it as a warm referral. So Alzheimer's, for example, we ask people 2 or 3 questions about their memory, how long have they been concerned around it, and the types of things that they are beginning to forget. It means that the conversation can start at a different place when the organisation get back in touch with the person. And it's reassurance. You don't need to go through all of the person's personal details. You've already have that as an organisation, and you can start the conversation where the person, has identified as the bit that they're struggling with. And that's repeated for carers. Again, it's a small questionnaire asking about your caring responsibilities. And for the Community Nursing Service, they were particularly interested in, obviously, the reason for the referral, but also the person's location, because it's in a rural setting. They wanted real clarity around why the person found it difficult to get out of the house and use public transport, but also their location for getting to them. I'm also going to go on and talk about personal data store, but sticking with Community Connections at this point, when you're on the site, you're invited to set up a personal data store, and if you choose to do that, and it does mean that any of the information that you share on the site is stored, and that means that information can be reused. So if you did decide that you were referring to Alzheimer's and then further down the line you felt that you needed to refer to the Community Nursing Service, then you're not repeating that information. It will use the information that you've already put on the site and populate the self-referral to Community Nursing. And I'll come back to that. So this has been our journey with Community Connections, what we were hoping to achieve, and that the service, the evaluation is close to completion, but to raise our awareness of local services at a much earlier stage. Staff themselves in the Moray area have commented repeatedly that they didn't realise that there was this breadth of service within Moray. So it's made their signposting much richer and more effective for people. And we're also at this stage testing what we describe as digital bundles. So the worker can pull bundles together. Quite often we're sending, especially third sector, quarriers, for example, would send a bundle of leaflets to a person through the post who had just become a carer. Things about finance, about housing, letting them know in general what they might be able to access. So we've tested through Community Connections that this could be made more effective by sending bundles, a similar digital bundle to cover those services. The other thing that has been evidence even prior to the Community Connections being set up is that often carers are searching for services out with office hours. They're doing that in the evening when they've got time. And again, a digital approach is much more useful for unpaid carers. They can actually engage with the service at 11 o'clock at night, during the night, whenever it is that they can find the time to do that. And just to mention that D6 is the IT provider for this service. And obviously Alice, we use the infrastructure. Just a brief look at Community Connections. I say this is not live, it's a slide that I've made. We've set it up like this because people told us that initially they don't know what it is that they're looking for. So although we have focused in this piece of work on older people and unpaid carers, an unpaid carer can be anyone, from a 16-year-old to a 70-year-old. So the site is very rich. It's got information on it for young families, for pregnant women, for teenagers, a broad range of mental health services. So it's very generic because we wouldn't assume who the unpaid carer is or the type of service that they would look for. As I say, this is just a slide from the live site. So if you went behind personal support, then again, you would see information. There would be an SDS tile, there would be a care at home tile, there would be care homes. We've set it up in this browsing way because people told us they were unsure of what it was that they were looking for. And they liked the style of this to explore what was in the Moray area. If you are clearer about what it is that you're looking for, then search services operates very much like any other, like Google or whatever. You can actually put in the name of the service or the type of service that you're looking for, and that will pull that towards you, or the area that you're looking for. And we can also do it by organisational sector, if it was particularly public sector or third sector that you were interested in. So those are some of the differences. The other thing that I would maybe mention is the site is slightly different because we've included commercial services. So what I mean by that is, obviously Moray is a rural area, and we've included pubs that provide, like a senior's lunch. We've included window cleaners, gardeners, handy person services. So again, what people told us was that, initially when they're becoming a bit frailer and less able to do these things, it's not necessarily statutory services that they're looking for. It's things within their local community that they will be paying for, and that, it's always a bit of a search. They're unclear about where these services are. So we've included commercial services as well as a third sector statutory services and any kind of volunteer organisations. So the personal data store, people may have set up their MyCare record in the past few weeks. I'm assuming that you know, if you don't, then I'm telling you. So My Care was launched by Scottish Government. It's maybe about 6 or 8 weeks ago. You can go and log on via your Scot account. In these initial stages, it's quite limited. It tells you about your vaccination history. It'll tell you about your allergies. Obviously, your GP's details are there. So it's the beginning of a journey for Scotland as to, you know, what I don't know what we'll call it in the future, maybe a person-held file, person data store, what would that look like? So the work around the personal data store has very much been a pathfinder, and particularly around how we pull in social care information that can be shared and what the usefulness of that is. So a quick look at what the personal data store looks like. The personal data store, we have developed this in conjunction with a company called MyDex. The security is higher, you know, definitely meets Scottish Government standards, meets military standards, as I would describe it. But it's a community interest company, and they have been on this journey for quite a while. The company has several people in it with lived experience for caring for their own parents. So they've got real self-interest in the concept of a personal data store. And MyDex are working with different groups. Some of the Promise work, it's MyDex that's working around that. And they've also developed a people app. I think it's with Hanover that they've developed that. So within the personal data store, the 6 sections that you see here, again, have been identified by citizens in terms of, you know, this is what's most important to them. From a self-directed support perspective, this is me, as we developed that around the person-centred planning tools that we use. So obviously within this is me, you're putting in your personal details, you're also talking about the people that are important to you, your pastimes, your routines. You might want to store photographs within that section. Talking about your home, you know, the where you keep things in your home, all of the important things that you feel that you might want to share with somebody, so that they, you know, get to know you better and will be able to support your needs a lot more effectively. So some of this would be familiar to you. The person at their leisure can talk a wee bit about the positive things about them, the things that people find challenging, what a good day looks like. So if you're doing person-centred planning, a tool like this should be familiar to you, and it's positive that the person just gets the opportunity to reflect on some of these questions in their own time. And hopefully, if they are eligible for self-directed support and they've been able to put some data in this, then again, it makes the conversation richer at an earlier stage, whoever that worker might be. The things that we also did was when people begin to put their data into the personal data store, there are 700 different data points within there, whether it's identifying the support that you need on a daily basis, or identifying the people who are important to you, talking about your pets, future planning. So we developed a dashboard, and the dashboard allows you to pull information from your personal data store, depending on who it is that you want to share the information with. So the information that you want to share with your care team, your personal assistant, is going to be very different from the information that you want to share with your GP, or the information that you want to share with your dog walker or whoever's looking after your pets if you go away somewhere. So we developed this dashboard, and literally people can pull photographs onto this of activities that they enjoy, or photographs of, here you see a cup of tea. People spoke to us about how repeatedly that they're often asked about by the care team how they like their tea. And even though it's written down in a file that sits on the kitchen table, you know, people seldom read that. So we're hoping that this approach can maybe bring it a bit more alive, about sharing that really daily information about how you want your tea, where it is that you sit and, you know, have your dinner, what time you want to go to your bed at. So we're trying to kind of make it easier and bring it alive for both the person and the care team. Other things that we're developing that are still under development in this journey that we're on with the personal data store is, you can see here, this is already developed, but for example, if you're now using 3 different services, then again, you can pull that in. I've taken this from my site. So I'm a bit rubbish with tech, albeit that I talk about it all the time. So I kept using the Quarriers example, but you could have on that site, say for example, you know, 3 or 4 different services that you've made a connection with that you're currently using. So people wanted that reminder, because sometimes when your care needs do become quite complex and you're using different agencies, you just want that bit of reminder about who it is that you're actually using. The other thing that we are developing is a calendar and a timeline, and again, that's based on SDS users saying to us that would be particularly useful in helping them engage with PAs and manage their care more effectively. I want to show you a wee video, so I'm going to very briefly, and again, you can look at these slides at your leisure, but just very briefly, here's the impact that we hope continuing this journey and working in this way with citizens. This is what we hope the impact would be, is that it's definitely a better journey for people to find and access services, that it would defer the use of statutory services, because we're helping the person self-manage and become more resilient, that it would improve communication and care management. The person themselves decides who it is that accesses the information in their personal data store, and they can make messaging connections via the personal data store with the social worker, the district nurse, whoever that happens to be. So we're hoping that it significantly reduces duplication. I've already mentioned My Care and how this relates to this, the journey of My Care becoming a richer file for the person and having their social care information in it. So we're also aligned to the digital front door work. So again, they're looking at the co-design that we're doing with citizens, the things that citizens are prioritising, and the designs that we're coming up with to get us to a position where in Scotland we do actually have a national digital front door. Again, you can look at this slide at your leisure, but it maybe helps you understand it's really a technical ecosystem that we've developed in Moray. So I'm talking about community connections in the personal data store today, but there is also weight management digital apps that have been developed that can connect to the personal data store. We've integrated with Morse. It means that our community nursing referral basic details can go straight into the Morse system, and we're moving towards, if the district nurse did a summary, that can go directly into the person's personal data store. It's a lot to take in, so I'd quite like to go to the video, and then I'll let people get the opportunity to ask questions.
We are Scotland's National Innovation Centre, funded by Scottish Government and Scottish Funding Council, and really our mission is to help citizens get better services through digital, to help NHS, local authority, third sector embed digital into service delivery, and to help the academic community innovate and do more research in this area.
Over the past 2 years, Health and Social Care Moray have worked closely with DHI to explore the contribution this work can make to the provision of health and social care for Moray citizens to ensure they receive the right care in the right place at the right time.
A really important part of the project was the co-design or participatory design approach that we took.
The ways that we've contributed to the work have been, I would say, many and varied. We've had staff time input to it, so been involved in the discussions, been involved in that co-design process, but also recruiting carers locally to take part in it because their voices were really important. And then being able to sort of endorse what we had said at the very beginning about this being relevant to them and this being a massive improvement in their experience of caring for somebody was really important.
By providing lived experience, everyone at the Wellbeing Hub and all of our champions and community members that we work with were able to contribute via ideas of how they would like to look for things, what they would be looking for, how might they be able to find things.
We're given the opportunity through the Moray Growth Deal to look at, how can we move care into the community, and we've really came to a point now where we have the tools. They're developed in a proof of concept. The first tool is a website, and that website has a range of different services. I think it's got over 600 services to date, and integrated into that is a personal data store. So the two work hand in hand. You keep your personal data store up to date, or people that are around you will keep it up to date on your behalf, and that means that that website will actually respond to your needs.
I think what's been quite unique in the work that we've done along with DHI is the time that we spent sitting down with citizens, talking through the ideas first of all, then testing those ideas and then taking them to a digital platform and then continuing to test that. So the systems have really been developed alongside Moray citizens and the staff in Moray to try and ensure they meet the needs of those people.
In our role, you're interfacing with very much the individual and they're never seen. It's always just a number. So to actually see this and each time you've twisted another bit on that accommodation, just props to you, good on you. This is incredible. In my wee brain, it's actually blown.
I care for my husband and my own. At the very start of his process, there were various departments and people sent out to interview him and things like that. And he was so frustrated because he couldn't speak very well about it, that he'd already talked about this to everybody before, and why was he repeating everything? And that it exacerbated the situation quite a bit.
Just being able to put all your details in and be able to access services and be able to refer yourself without other people having to do it for you or without any delay in it being done would have taken so much stress away and taken away the worry as well.
As a social worker, when I go and visit somebody to carry out an assessment, it's important that the person feels comfortable enough to share the information so that we can gather all the information needed to meet their needs. It can be quite an intrusive experience for them.
I think the personal data store gives people gives them a bit of autonomy because they can, they can put in all the information they want at their own leisure. They can sit there, they can do a bit half an hour at night and then get tired or whatever, they can leave it to come back the next day.
It's about telling the story once instead of having to repeat themselves. We find a lot of the time that people are, I've already told somebody this, I've told just 10 people this, and it's being able to share the information with other professionals.
You just pull it all through and you pull it all together and you make it your own without having to sit down and duplicate everything.
We've been able to give feedback in real time, we've been able to talk directly to the developers, we've been able to make them understand why things need to work in a certain way for carers, and that's been fabulous.
Having these systems in place as business as usual would really, really help services focus on the actual problems instead of having so much form filling.
From where we've got to with Care in Place, and we've covered a lot of ground, and there's a lot of good evidence that's starting to come through, I would really like to see it being adopted, and actually that tool is in the person's hands, and they have the ability to take that information wherever they want to go and actually interact with lots of different services for the benefit of them, but also for the benefit of services around us.
Can I also introduce, I notice now that I can see the faces. So Charla, the Chief Technology Officer from DHI, is also here, and Ian MacDonald, the Head of Service in Moray. So if people have got questions, then that's great. You've got 3 folk around that can answer.
That's fantastic, Marlene. Thank you. That's a really, really interesting presentation, and kind of good to see, I guess, the scope and just the involvement of people in it in all different ways. So I just wonder if anybody would like to start the discussion off, any reflections or any particular questions for Marlene or the team in Moray. Karen, in you come. Nice to see you, Karen.
Yeah, thanks, Donna. A really good presentation. What I was coming through loud and clear, and we hear this continually as we connect with people, is not having to share your circumstance, your story. You had an unpaid carer talking about her husband, and just not having to do it again and again and again, which is frustrating, or it can be confusing, or sometimes the ask of to actually explain what's happening to your life at that point. The appointment for that might not even fit in with that natural structure of their day-to-day life as well. So there was quite a lot of parts that I was listening to, and it definitely resonated with the people that I meet. So I'm really glad that came out strong with more than one person on that presentation, and we've certainly a lot more to do to improve on that. Thank you.
Thanks, Karen. Definitely. I mean, I think that the design wouldn't be as rich and good as if we hadn't done such extensive co-design and gone back and tested it and taken on their point of view. I think probably for me, I mean, I knew before we started how important unpaid carers were, but I think that, you know, the past 3 years has really emphasised just we really need to start treating them like a workforce and give them that level of importance in terms of, you know, supporting people and keeping them in their own home. So they definitely had a voice at the table. In fact, we couldn't shut them up, some of them.
I'll vote for that. And we're nothing without them. You're quite right. Thank you.
Steve, come on in. Thank you. Perfect.
I'm actually from Elgin, so it's nice to get a kind of an insight into what's happening in my local area. I haven't lived in Elgin for a number of years, but it's nice to see what's happening. So I agree with Consent's presentation. I think carers do get frustrated with the amount of times they tell the same story, and they're obviously busy doing other things in the person's life as well. And I think as some of you just touched on there as well, we need to kind of focus more on unpaid carers, because without unpaid carers, we would be in a further crisis, which we currently are at this present time. So I really enjoyed the presentation, and obviously the way forward is collecting all information to support people as best as we can in the community. So it was a good presentation.
Yeah, I think Steve as well, just a bit about, you know, unpaid carers come in all shapes and sizes. So the site is very wide ranging. You know, it can be a 16-year-old to a 70-year-old. So there's, although we focused on older people and unpaid carers, I mean, Ian will probably agree with this. We see other opportunities as to how the site could be used in the Moray area. And particularly maybe younger people who are using SDS. It gives them a an easier way to really identify the breadth of services that they might be able to use to meet their outcomes. So we hope that, you know, for SDS users, obviously particularly unpaid carers and older people, but for younger people as well, we hope it will be useful.
Thanks for that.
Thanks, Marlene. Rona, please come in.
Hi, so I'm also in Moray as an SDS advisor, employed by Cornerstone, and I found this really interesting, and that I need to go and look a wee bit more into it. So when I'm out visiting, I'm often told everybody else, you know, but as an independent, I don't get the information that they've told other people. So I think this is really interesting and progressive. So I'm going to have a look further into it. So thank you for that.
That's great, Rona. I mean, I can do a demonstration, a live demonstration to your team. There was always a bit of confusion about who was doing the independent support in Moray, but
so I'm the team.
You are the team. Maybe that was what it was. Well, can do a live demonstration for yourself so that you can understand it better and
I would really appreciate that.
Test it out for yourself.
Great stuff. Thank you.
Marlene, can I just ask, you know, in terms of that person-centred outcomes approach and people being the kind of commissioner of their own services and support, where does somebody's support plan sit in there? Where does their ability to kind of record how they're meeting their outcomes and who's helping and doing what? That's one part of my question. And maybe the second part is when we're looking at the national digital front door and the My Care Scott app, you know, are we going to be able to use this learning to kind of have that approach within that kind of work? Because we know that having your vaccinations and other things is maybe a bit simpler than telling your story about how you want your care to keep you well and keep you independent. You know, we know there's multiple things that happen in the social care. It's an amazing landscape that we have in Scotland. But, you know, so the two things, yeah, where your support planning and how that fits in as you as the commissioner of that. And the second bit, what's the national learning from this really, you know, powerful piece of work?
Okay, so I can do the first bit and Chal will maybe do the second part. We have, so where does the person store their outcomes? So specifically, we haven't created, you know, a specific area. It wouldn't be difficult to do that, as in list the outcomes. But what we have certainly recorded is, so within This Is Me, for example, I think there was about 5 different person-centred tools that workers would use. So they are in there, and if you know, have gone in as an individual or been helped by your family to complete a lot of that, then it certainly gives the worker a clear indication of the lifestyle that the person is hoping to achieve, and a clear indication of what the outcomes need to be. There's also a section which is around my support. So it's very clear in that section around routines, the type of physical help that you need in real detail, you know, around some of the things that we don't like to talk about and can be difficult for people, like continence care, how they want to be showered, how often they want to be showered. So the tools for, if you like, interrogating, maybe that's the wrong word, but, you know, drawn from the person exactly how they want their life to look is definitely there. Within Moray and the team, for various reasons, there was, you know, limited development time with them. But if Moray continued to use this as a tool around SDS, then it would be very easy for us to put, if you like, a tool there that the SDS team could use, and that kind of, you know, lists the outcomes, helps them with a review type situation. I'll hand over to you, Chal, for the national bit.
Yeah, so I sit on the My Care Scott delivery board, and DHI has a kind of portfolio of projects that are feeding into the pipeline for kind of service development for mycare.scot. There is an exercise underway at the moment where Ricky Iversholt and others are shortlisting more social work, social care, third sector, independent sector kind of use cases. So they're trying to kind of rebalance the scales, which are quite NHS dominated at the moment. And so most of our work was anticipating that it was going to be NHS dominated 3 years ago when it started to kick off. So that's why Marlene and I did the work, because we knew it was going to be relatively easy to do NHS oriented stuff. The reason that's easy is because the NHS has more consistent systems. So if you want to access vaccines, well, every GP system is connected with vaccine data. If you want to access your outpatient appointment information, every hospital uses the same system, more or less, in Scotland, so it's easier to do. The difficulty in the social work, social care space is there's so many different systems. That said, we are proving that it's possible. We're starting some work to try and integrate with Mosaic in the first instance, and then try and hit other case management systems. So that'll be this year's work, and effectively it's just the usual thing. Someone has to go first, and so we're trying to go first so that it's easier for the national team to kind of follow suit with far less risk. Effectively, that's the plan. Hopefully that helps.
No, that's super helpful, Charlotte. It's just good to hear that there's a social care, social work conversation going on about the practice and people's lived experience of getting the support they need. So that's good to know. And it sounds it's really, really interesting work, isn't it? And the feedback that you've got from carers and from people who use support is fantastic. Yeah, Charles, come back in. Thank you.
I would say that if you like the sort of thing that we're showing you, and you want it to be in the national investment so that it can be widely available, then the more voices that say that at a policy level, the better. And there will be always a default turn towards NHS use cases, and so you have to really shout loud. I know you're used to doing that, but we can help you articulate what good looks like from a digital social work, social care, third sector, independent sector kind of perspective. So I would just really encourage this group to pull the levers that you have to ask for this, if this is what you want to have, not what we've built specifically, but the concepts. If you like the idea of these sorts of concepts, then I think we need to organise more formal requests from social work, social care policy groups into the mycare.scot environment.
That's fantastic, Charlotte. And guess within the self-directed support community, I guess the way we do social care in Scotland, it's good to be able to provide these platforms and spaces to have those ongoing discussions. And we know that digital is a golden thread through everything that we do. So absolutely, if you guide us or give us details, Charlotte, we'll make sure that goes through not just this seminar, but through our wider self-directed support community, most definitely. Thank you. Anything at all from our Moray colleagues, but I guess the ones that are part of the research and have the challenge of implementing or taking it to the next stage? Anything that they would like to say?
I'll come in on that, Donna.
Thank you. Thanks, Ian.
I'm Ian, Deputy Head of Service in Moray for Health and Social Care. I just support what Marlene and Chal have been saying. We've been working together on this for 3 years, sort of plus, and the bit that's been emphasised about working very closely, in this case with unpaid carers and with staff, and really building that model up over time is what's given it the real strength, I think. And then more recently, having that Moray Community Connections site and how that offers that range of choices that are available to offer people through that, individuals, family members and staff, to see what's available is something quite unique, I think. I've been sitting on some of the frailty work that's been taking place nationally, and in particular more recently on the Gurphy work, and you could almost take that Moray Community Connection site and put Gurphy branding round about it in terms of putting people at the centre, making sure they're able to make choices, seeing how a plan fits around them, etc. So the potential it offers is really strong, both for Moray, and we had a sort of celebration event last week for 2 days in Moray, and it was really emphasising, in a sense, the need for that national move in this direction. There's a risk we develop something in Moray in isolation that then gets trumped by something wider. So I know that Charles and Marlene have been very much feeding into the national discussion, which is heartening. But yeah, I just urge people to just click on that link and have a wee move through it for the Moray Community Connection side of things. And you see how ergonomic and natural it is to go through that process. So no, thank you for the time today. I appreciate it.
Not at all, Ian. And I think, again, if there's an opportunity for, future discussions in future ways around this community, we'd be very happy to kind of facilitate and support that. And just those ongoing conversations. We have Callum Campbell, who I know you know, Marlene and Charles, from, doing the digital social work practice within Social Work Scotland. So we've got those connections internationally, but it is so important that social workers have a say and what that looks like, because it's a tool for them as well in terms of self-directed support implementation. So a huge thank you, Marlene and Charles and Ian, for giving us your time today and the presentation. The slides will be out, there'll be a recording, share it widely with colleagues, and if you think there is an opportunity to have future conversations both within the self-directed support community or wider, then please let us know, and we hope that that's been really, really helpful, and just got you thinking about practice and opportunities within your own area. So thank you once again for your time, and have a great rest of the day. Thank you.
Thank you.